So everything will be assessed, and then accordingly they help. All right. Somebody's writing, chatting. All right. Okay. Hi. All right. So back to residential facilities and residential care facilities and the home care package, home facilities. This residential facilities, if you want to know a little bit more, so it's similar to living like in apartments, like they all have their own rooms, but they share some common things like common, it's important to know because of COVID, I'll tell you later. So they share some common rooms like dining area, activity area, and so on. So they have their own privacy, but they also have common things to share. All right, when COVID-19 came, lots of restrictions came into place, especially for elderly. It was challenging because of social restrictions. So the family or the cared ones or the friends do visit them, and I know people who visit every evening to feed the residents, to be with them, or to have fun with them, to play with them, to read them stories, the grandchildren coming in, entertaining them. So all those things were their day-to-day activities. They look forward to meet their family. The family come in and take them out for lunch and things like that. So that's how it was. It used to be, yeah. And then came COVID, and things changed. Lots of restrictions came into place. All right. So let's go into next slide. Next slide, please. All right, we see here again the states, but then 2 states are marked red. Why is it? It's because in the beginning months, Australia was very successfully fighting against the COVID-19 crisis. So the main strategies were like social restrictions and early case identifications, etc. So it was very successful, but something happened. So from June onwards, we saw a second wave hitting Australia, especially in 2 states. So we see that all other parts of Australia being okay, let's say okay, and the restrictions were eased and people are enjoying their life. New South Wales and Victoria were suffering. Why? So we really don't know. There are conflicting theories why and how it happened and so on. So it's especially Victoria, Melbourne, based in Melbourne City, the big city. The second wave hit and complete lockdown came in with stage 4 restrictions like wearing masks and so on. Some say it was due to the violation of hotel quarantine, which we were applying for overseas travelers. So some people were not really taking care of it. Or some say it's because of this asymptomatic carriers. So asymptomatic carriers is that when people are infected but doesn't show any symptoms. And pre-symptomatic carriers are those who have infected themselves, but the symptoms are not yet coming out. They are not showing any symptoms because of this incubation time and so on. So those both are dangerous, potential danger. So there is no evidence-based about this, but still we take in consideration maybe that's also a reason for the community spread and so on. So what happened is now in Australia currently, 2 different states. So New South Wales are east a little bit, but Victoria is still under, I think it's, if I'm not wrong, it's stage 3. So it's not stage 4 anymore, but still people are very cautious and people are taking care and mindful and so on. All right. Okay, let's go to next slide. Next slide, please. Okay, why is it said that elderly is the most vulnerable group during this pandemic? We all know the answer. Well, I have to say something before. I know lots of, since I work with elderly, I know lots of people are resilient, lots of them are experienced, lots of them are leading a healthy life, and they know how to deal with the situations. But going into the facts, aging brings lots of physiological changes in our body, invisible and visible changes. So our, let's say, the immune response is declining, and maybe there are some potential dangers, so underlying medical conditions, and there may be people suffering from comorbidities. Comorbidity is a term showing if somebody is having more diseases at the time, so more than one disease. All right, all these things. And another important thing, when we look at the death rate, we see clearly that it's aged or elderly got a threat. COVID-19 is a threat for them. So we see that. So very clearly they have to take care. So we have to protect our elderly. All right, so we all know that the elderly need support from us, from the community, in many ways, because they are not. It's not easy for them to access to the society. If you think about food or household items or grocery shopping, so they need the help and maybe the delivery system. So they are in contact with many people. Also the carers, those who care for them, and they have to get the medical support and so on. So they need to go out, or they need to be in contact with others. And there's all these social restrictions like visitors ban and residential care facilities all are affecting the elderly. We see that they are really, really suffering under it. So all these factors shows why they are vulnerable, right? Okay, let's go to the next slide and see one graph. Okay, this is a study conducted in China, where it started. So they say, if you have a close look, we see that fertility rate raised by age. We see that. Look at that. So 80 plus have a high rate of fertility rate, like 14.8%. So, and we compare it with 10 to 19 years old, it's only 2%. So it's clear, visible. So studies are going on. So specific tests are going on, and yeah, we will be more informed later with coming China. I think that it shows clearly the elderly are more at risk compared to other age group. All right, let's go to the next slide. Okay, yeah, let's see the impact. So for economic students, let's start the major, the important impact is the economic impact. We all know that it's everywhere, not only for elderly, for all, for everyone. So we saw that. So business closed, the institutions closed, and we have financial insecurity going on, financial uncertainty, job loss, and people are concerned about finance, about the economy. Nobody knows what comes next, what's going to happen. So everybody's guessing. Everybody make plans for survival and so on. So let's have a look at, let's compare with Australian economy. We have to say the coronavirus, the COVID-19, put Australian healthcare sector under immense pressure. So in the beginning, if we take the case March 2020, when it was really starting or picking up. So, the first COVID death was happened in Australia. I think it's on like January 2020. So So by March, plans were made because we saw the sudden spread. So everybody was aware we have to take steps. So Australian Health Management Plan for Pandemic Influenza, that's AHMPPI. So they were very aware of it, and they said Australian healthcare sector is well prepared to deal with the pandemic. So they were their strategies were like to deal with economic impact and all of the impacts. They were going on with strategies like they wanted to imply early case identification and social restrictions. So early case identification was very important for them to prevent the spread. So prevention, we all know prevention is better than cure. Yes. So they said they were taking into consideration about Australian health sector's annual budget. Maybe very interesting for the economic students. So Australia is considered to be, the healthcare sector is considered to be one among the best. Yeah. So because of the annual budget. When we consider a year 2017-2018, Australian healthcare system had an annual budget of 185.4 billion Australian dollars, 185.4 billion Australian dollars annual budget. So to make it simple, so each person like 7,845 Australian dollar. So when we consider that, that would be efficiently, that would be good enough. Yeah, that would be efficient to deal with it effectively. And they were sure of controlling it, and yeah, they were sure of managing it. But then when it happened, the pandemic outbreak went out of control everywhere globally, and also in Australia. Like it was peaking, and people were afraid of community spread. What happened was they were reconsidering the strategies and plans, and they were checking the hospital resources. So they found out that the resources are limited. So potential resources were limited, like life-saving equipments like ventilators and oxygen therapy, all those things, hospital beds. So they made a plan. So it was like elective things. So those which were non-urgent, like all the medical appointments, non-urgent, they were cancelled or rescheduled. When social restrictions came in place, everything had to close down, so people were not allowed to go for face-to-face consultation. So they had to go with the telephone consultation, telehealth consultations, and so on. So the healthcare department wanted to save for the picking or save the resources. All right. The economic impact were coming, but then they gave, that was the idea, to stimulate, so to boost the economy. They started to boost the economy by putting stimulus packages in healthcare sector, in the hospitals, in aged care facilities, for more staff, for hiring more staff, because shortage of staff was one of the problems to take care. You need better precautions, you need better techniques, you need to be aware. The staff were feeling overwhelmed, they were stressed out, there were burnouts among the staffs because of all these things. They were putting their best, they were giving energy, they were giving their time. Things were difficult when it came to care for elderly. We have to, again, I wanted to remember you, the elderly is having comorbidity, as well as some life-threatening situations. Some have this, like all those comorbidities like hypertension, diabetes, let's say cardiovascular diseases, and elderly like they are suffering depression. Let's say cognitive decline in case of Alzheimer's disease. Alzheimer's disease. All right. All right. So those were things. So the health department had to put more stimulus packages in aged care sector, and all those hospitals and clinics, fever clinics. It was very important to test. If somebody says, I have the symptoms, they have to have resources to test, then to have the early identification. All right. All those things impacted the elderly, let's say. Economic impact. So that was how the country balanced the economy to stop this falling down of the economy, or the declining scale, to stop it. So they were boosting the economy with stimulus packages, lots of support from government side, like with low-income people were supported and so on. Later on some of the slides, I will show you more about the economic relief from the government side. So you will see how the government deal with this. All right. So at this time, I want to tell you one more thing, one more important factor which impact elderly life. It was mental health issues. So, being said that the resources were limited, and the healthcare sector was keeping them for making COVID-19 as the main focus. So all other let's say non-urgent procedures for a later appointment, cancelling the appointments, etc. So that made the elderly people panic. Along with that, maybe you all have heard about it. There were news and reports like from overseas, things were happening like the comparing elderly with young persons, like they were prioritizing life-saving equipments and resources for the younger persons, because the younger persons have the most life expectancy, so better life expectancy. Yeah, so all these things, it's quite unfair, I would say. The elderly are the ones needed protection. So those who had comorbidities, those who had weakened immune system, so the news was that they were not prioritized, the younger people were prioritizing. So I hope not everywhere it's the same. Well, here it was this news made mass panic among the elderly. So they were thinking about themselves: what if I'm infected? What if I get severely ill? If I'm seriously ill, then I won't be given any priority, or I won't be treated, and things like that, which is a circle that made them more anxious, that made them more depressed, that made them more lonely. So the mental issues we had to address a lot. Along with that, the elderly people have, I would really say, everywhere in the world, they were the one who was challenged and had the most threats because of COVID. Let's say, again, let's take, I'm talking more about Australia. Again, I want to remember, you may be in India, it's different. I know the cultural settings are different, but let's talk about Australia again. Think about the residential care setting. So the visitor restrictions were there, visitor bans. So the loved ones was not allowed, the family was not allowed to come in. And what happened is the elderly was so concerned and so many worries. They were thinking about their family. They were thinking about what happens to my family, where are they? The elderly people worries a lot. We all worry. We can't generalize it anyway, but maybe they take care, more care, let's say that way. They are worried about their grandchildren, about their children, and they think, what if something happened to them, whether we are allowed to come and see them, or if something happened to them, nobody will take care, who are there for them? So they feel really lonely and anxious and distressed, discomfort, and all those things. And also about their medications, whether they get their proper medication at times, whether who is taking care of them. And they also have some kind of stress about the carers, like those who care for them, nurses, GPs, doctors. Are they carriers of COVID? Am I safe from them? So all those concerns, and yeah, these all needed to be addressed, because we saw that we know that mind and body function together. So if they are more worried, if they are feeling more lonely, prolonged isolation bring them more loneliness, and they get physically ill end of the day. So it was very important to take into consideration about that they are not feeling that lonely. How can we connect with them? So people started to think about how. So this became very important. This incident brought into light the importance of digital media. Like, we had to educate them to use digital media like Skype, Zoom, like Google Meet or FaceTiming, whatever. Yeah, so it was very important to use all those digital medias. Again, there were some problems like technical illiteracy, like technology. They don't know much about it, so, and they need to have this equipment like webcam, computer, or at least a smart telephone to communicate. So all these things, they need internet connection, the speed must be considered, the bandwidth, etc., etc. They need a quiet room to communicate. So all these things came into light. So people considered about it. There were volunteers coming in. There were volunteers coming in to help, to educate them, and there were online resources educating how to order grocery online, etc., etc. Yes, so many things. All right. So all these were impacts. So let's go to the next slide, please. The next slide. Can you show the next slide, please? Hasina ma'am, is the slide going on? PPT going on?
Ma'am, please wait, ma'am. Here, there is some problem in internet. That's why.
All right, no worries. All right, no worries. Let's talk about. I'll try to continue with the without the slides. There were lots of economics packages to boost the economy. So, like the government announced. Hasina ma'am, please say when the slides are ready, please. Okay. There were lots of Yeah. See, lots of changes here. The government issued lots of low-income persons to have economic packages, like job keeper payment or job seeker payments to boost the economy. Job keeper payment was like if you lost your job, and you're suffering under that, and you're not having any income, so the government was giving certain fortnightly. Government was paying like $550, etc. So maybe the amount differs, but the government was paying fortnightly. Or if you are unemployed, it's job keeper payment. So all those Corona supplement payments, those were Corona. All right. Hello.
Yeah, ma'am, it's audible. Here is some
Ah,
problem in internet. Actually, the slide is working here, but there is some problem for you from here.
oh, okay. No worries. If the slide is working, you can just keep on so everybody can see that. So anyway, I can't see the slides, but doesn't matter. I will tell about the how the government boosted the economy. Yeah, all those things like yeah, in the slide you can see it more clearly how the government stimulated it. So there were lots of packages like the government was supporting aged care facilities, the government was supporting businesses, the government was supporting different people, like individual people living in remote areas, doesn't have access to the mainland when the restrictions were going on. Yeah, and if you can see the slide, you will see a detailed list of the uh, things government made so to ease the restrictions. So at the moment, yeah, at the moment it's difficult without slides, but I would say it was like everybody is in the same boat. So everybody was being mindful about the effects and keeping an eye on COVID-19 symptoms and taking care of each other. There were volunteers coming in to work for others and those who need, and everybody helping each other. And well, I would say, quoting from WA, from Western Australia, we are lucky to keep our life standards because of all these things, because of all the help from the government. Uh, yeah, so that's how Australia kept on going and still going on, and we have to cross the fingers that the two states like New South Wales and Victoria need to be come out of the situation and ease the restrictions. Ah, there you go. Thank you. Wonderful. All right. These were the impacts. Maybe you all read all these things. So economic well-being, mental health, vulnerability, life and death, and abuse and neglect. So we can go on to the next slide, please.
അത് മാറ്റി എൻ്റെ അടുത്ത് വെച്ചു അതാണിത് ഞാൻ ടൈപ്പ് ചെയ്തുണ്ടാക്കിയതാണ് വേറെ നിങ്ങൾ എടുത്തോ ടൈപ്പ് ചെയ്തോ അതെങ്ങനെ ദിവസമാണ് ഒരാളത് മാത്രം നോക്കട്ടെ സച്ചിനെ ഞാൻ എന്തായാലും ആദ്യം
All right. Excuse me, I can hear your conversation. Can you mute yourself? Oh, super. Thank you. All right. Yeah. Can we go to the next slide? Yeah. Let's go on. Let's go on. This is just some pictures. All right. This happened. This is a circle. So when prolonged isolation happens, so supporting, yeah, keeping each other. All right. Pause. Yeah. All right. That's okay. What we can do, support all the others, and go on. Go on. Go on, please. With the slide. Yeah. All right. This is right. Okay. This is what the government did. So they did the infection control training. So it was very important to bring the awareness. All right. The slide, please go on. Go on. Thank you. Continue. All right. This is what happened. Like screening was possible. Some people are still talking. Can you please mute? Can you please mute yourself? Hello, can you hear me?
Yes, ma'am. It's clear.
All
you can
right.
Continue.
All right, thank you. So this slide shows, so it was a liberal screening for COVID-19. So you just can go with the car and you get tested. You don't need to get out of the car. They will come and take the sample from you and you will get results in 48 hours. So that was very important. So easy, the early detection can go on. The next slide, please. Yeah, you see how they are taking it, the samples. So it was very convenient, very private. Go on, the next one. All right, these are just showing some slides with what happened, that everybody was together, like schools, publishing, to be together, fight against COVID-19. All right, go on. The slide, the next slide, please. Yeah, stay home if you're unwell. Next slide, please. Yeah, these are all things we talked about, keeping physical distance and yeah, tapping. So here we have the watch to tap or cards to tap, so minimal face-to-face there. All right, okay, continue. This is the same, how we can fight against COVID, okay. Go on. This happened when the restrictions came into place. Everywhere it was closed. People had to stay at home. All right, the next slide, please. So this is, it's so seldom you see this opera house like this in Sydney with so less people. It was really, really empty. It was very strange to see the pictures when the pictures came. All right, next one, please. This is our premier. This is our Prime Minister Scott Morrison, showing the restrictions being eased, like with step 1 to 3, slowly, step by step. The next slide, please. So this is how it started, like easing the restrictions, people getting better and better. More nowadays, it's completely over. The restrictions, we can gather, we can do everything. You see that I'm not using a mask. So maybe the situation will be different if I was sitting in Melbourne. I had to use the mask. So I'm not using the mask. It's not mandatory here. All right, the next one. So that's about the economic stimulation, which I talked about earlier. So next, please, next slide, please. All right, this is the 2 important stimulus packages regarding our economy. So JobKeeper payment for those who lost their job, those who lost their jobs or those who can't go to work and lost their jobs. So job seeker payment is for unemployed people, those who are having no jobs. So these 2 different stimulus packages, they were paid fortnightly every 2 weeks. Yeah. All right, the next slide, please. Okay, again, the government is issuing the package, stimulus packages to boost the economy. So you see that $550 per fortnight job seeker payment, they increased it, and more staff for care workers. Yeah, you see lots of financial aid. So you could take away from superannuation, etc., etc. Next slide, please. Yeah, again, relief payments and assistance packages. So they nearly covered everybody who needed assistance, like those who are not having jobs and those who are having low income and so on. So all Australian resident citizens, they were considering them. All right, the next slide, please. The next slide. Okay, there you go. This is what happened in Australia. So just a comparison, you see total death in Australia. When you look at the down part, so bottom part, you see that total deaths in Australia is 894 deaths. From that, if you compare in Western Australia, where I live, the state of Western Australia, WA, you see the deaths are 9. So yeah, so we can see the states are having different death rates. Yeah, so, and if you see the curves, you see that it's peaking during August because of the Melbourne second wave. Yeah, and then going down, it's declining, curve is declining, luckily. All right, okay, so what we do, we are showing compassion to others. We are going and helping others. We are taking into consideration how others are and helping them. We are talking to elderly. If we can't go face to face, we are just talking with them in the phone or FaceTiming, Skyping, Zoom. The families from different parts of the world are in. All right, so even if, let's say, even if you can't go and visit everybody, that doesn't mean they don't love you. So we are showing compassion, we are showing love through calling, making sure that they are okay, asking them how they are, etc., etc. And everybody is showing companionship. All right, the next slide, please. So, this is a poem. I liked it. So you can see that it's not just happening now. It happened, this poem was written in 1869 and it was reprinted in 1919 pandemic. So now we still read this. So it's very important. I just read 2 lines from there and then 2 lines in the end. So this is timeless. And people stayed at home and read books and listened, and they rested and did exercises and made art and played and learned new ways of being and stopped and listened more deeply. All right. Okay. I keep some minutes to read this, but very important to read the last lines from the right side. History will remember when the virus left. It's about future. And the houses opened, and the people came out and hugged and kissed and started again, kinder than before. All right, so this poem, I give some seconds for the slide just to read. This is wonderful, beautifully written. I liked it. So it's ageless, so it's for everybody. History will remember when the world stopped and the flights stayed on the ground and the cars parked in the street and the trains didn't run. See, it's same about today, same about the left side, and it's about today, the right side. All right. Okay, I hope you read. So let's go to the next slide. Okay, I think I'm ending about it. So let's, everybody, you heard about the impact here. I'm sure it's not that different which happened in India and everywhere. So some, I think some people are listening from Germany and some are from Great Britain and some from Australia as well. So for everybody, it's the same. We are all together in this journey. We have to keep together. We have to be aware. We have to be mindful. We have to stick together, not in physical sense, but mentally, or just give love and care just show. It's a time to reconnect. Yeah, it's a wonderful time point to reconnect with our loved ones, with the elderly, whoever need our care. Just rethink about the strategies. How can we help? How can we connect? Yeah. And pause and remember, nothing lasts forever. Better days are coming, promise. We need to have hope, and let's cross our fingers that a vaccine is found very soon so we can end this pandemic. Okay, I think that's it. Thanks for coming here and attending this webinar, and I hope you all stay happy and healthy and safe, and give your love to your loved ones. Keep your loved ones happy, and let's hope that this pandemic ends very soon. Thank you, everybody. Thank you for the persons who are operating this PowerPoint. It was greatly helpful. Thank you for the Department of Economics. Thank you, Hasina ma'am. Thank you, everybody, for participating. Thanks for having me.
Thank you, ma'am, for your wonderful presentation. Now the floor is open for you. You can ask questions if you have any doubts on this topic.
Anybody? Hello, James Matthew. Nice, and thank you so much. Thank you so much. Rania Piran. Hello, Rania. If you have any questions, you can ask. I hope it was clear and gave you some guidance. Nice class, miss. Thank you so much. Excellent presentation. This was a nice presentation. Vandana, Anjali, it's clear, wonderful. I'm happy. Nice presentation, ma'am. Dr. Sina. Wow, thank you. It's very important to be together, to update, always update. Ranjit, nice class and informative class. Jabir, thank you so much for having wonderful presentation. Shruti, thank you, ma'am. Excellent presentation. Ashika, nice presentation. Shahida, nice presentation. Salim, nice class, miss. Shiny, thank you, ma'am. My pleasure. Adila, nice presentation. Ranjima, informative session. Vipisha, thank you. Shanu, thank you. Fatima, thank you. Shamima, nice presentation. Wonderful. Sritu, nice presentation, ma'am. Thank you very much. Pleasure. Hujna, thank you, ma'am. Nice presentation. Akila, Shahana. Vishnu, nice presentation. Vinita, thank you, ma'am. Ashwati, thank you, ma'am. Sudesh, nice presentation. Danyan, thank you, ma'am. That's an excellent presentation. Wow, that makes me happy as well. Anjali, thank you, ma'am. Ashika,
good
we
evening.
are happy to get nice class. Chitira, Natula, thank you. Oh, sorry, somebody is talking. Sorry. Sorry, I didn't
Madam,
hear.
can you hear?
Oh, yes. Yes, please, do tell.
Okay. Good afternoon.
Good afternoon.
Madam, is there any global criterion for a quarantine or isolation period?
Well, it's likely the same. I think 14 days. Yeah, 14 days. Definitely quarantine is important. Taking into consideration the incubation time and so on. So we all know that there could be asymptomatic people or pre-symptomatic people. So this quarantine time is very important for pre-symptomatic, like you are infected maybe, but you hasn't starting to show the symptoms. So it's very important to quarantine 14 days. So lots of studies are going on. We have to keep an eye on it. We have to continuously update about the studies and informations we are getting, because maybe new information is coming about this quarantine days and the things. So self-isolation is important. If you know that you are having the symptoms, quarantine is very important. I think it's globally the same. Yeah. Was
Okay,
your
thank you.
answer, was your question answered? Oh, all right.
Okay, thank you.
No worries.
Thank you, ma'am, for your wonderful presentation. It was very informative and supportive for us. Now I call upon the program coordinator, Mr. Ramdas, faculty from the Department of Economics, for a vote of thanks.
Good afternoon, all. As all good things come to an end in life, so is the webinar. On behalf of the PG Department of Economics, MES Kaladi College, Manarkad, I take this opportunity to propose vote of thanks to those who have directly and indirectly contributed this webinar on impact of COVID-19 on elderly, a case study based on Australia. First of all, I would like to express my sincere gratitude to our beloved principal, Dr. T.K. Jalil, for gracing today's webinar and delivering the inaugural address and his enthusiastic support. I would like to a special thanks to our HOD, Dr. Hasina VA, and my colleagues for their unflinching support and coordination. Then I would like to thank our resource person, Sheena Diaz. We are really enlightened with your knowledge and presence. I would like to express my sincere gratitude to uh, our technical support team, Mr. JULFAR and Mr. Sahal, for their timely technical support. Last but not least, our heartfelt thanks to participants of this webinar for their active participation for making this webinar on a grand success. With these warm words, we move to the end of this webinar. Thank you.
Thank you, everyone.
Thank you, ma'am. This is the end of the session, and we are expecting your cooperation in the near future with our organization. Thank you.
Definitely.
Participants, please fill the feedback form. Feedback link is available in the chat box.
Sir? Hey. ആരെങ്കിലും അറിയുന്നു. ഡോക്ടർ നിനക്കൊന്നും കണ്ണ് കാണൂലേ?